Welcome to Medical Terminology and your first lecture. This week we cover how to interpret and understand any medical term you may encounter by learning about combining forms, word roots, and prefixes. Let's get started. Here are some building blocks, as learning medical terminology is a lot like playing with blocks. You can build a word or break down each word to its root, prefix, and suffix to better understand its meaning. Here are your objectives. They are the same ones you have in Connect. What exactly is medical terminology? Well, it is the language of medicine. Just like English or Spanish are languages, medical terminology is a language of its own. It's how healthcare professionals communicate to each other about patients. By using these terms, we avoid mistakes and help to relay precise information quickly. Learning medical terminology will be a lot like learning another language. Just like learning a new language, you must learn the vocabulary. The word roots and combining forms represent the basic vocabulary, and we can modify these words using the prefixes and suffixes. This course is only an introduction to medical terminology, and you will continue to build your skills as you advance in your career. Before people had a written language, they had a spoken language. Then they learned to write words down and produce symbols to represent those words. Medical terminology first came about with the first physician named Hippocrates. He was of the ancient Greeks, and much of our medical language is derived from Greek and Latin because of this. New words formed over time, but still reflect this heritage. Combining forms consist of word root, and this word can be modified by adding a prefix before it or a suffix after it to change the meaning of the word. You can also look at it this way. If you encounter a new medical term, simply break the word down to the root, prefix, and suffix to figure out the meaning. Let's practice some word building using a train model, as trains have the engine attached to its cars before they leave the station. First, our train engine represents one of the parts of the word. In this case, cardio, which means heart. And a train car ready to hitch up to the train is ology, which means the study of. What will happen when we put the train together? Now the train is together and has formed the word cardiology, which means the study of the heart. Another engine has the word fragment brady, which means slow. And a car nearby has the word piece cardia, which also refers to the heart, but more to an abnormal heart. Now we will put this train together like we did the prior one. This train is together and ready to go off and has formed the word bradycardia, which means slow heart. This is a heartbeat less than 60 beats per minute and is a pathological condition. Another engine sits with the word tonsil. This is a tissue in the throat that can swell up if infected. A car is nearby and has the word fragmentectomy, which means removal of. What will happen when we put this train together? Another new train is ready to leave the station and has formed the word tonsillectomy, which is the removal of the tonsils. I wonder what a more complex word would look like. Now, this train engine sits with the phrase hypo, which means low or below, and two cars sit behind it, ready to couple up, one with emia, which refers to the blood, and calci, which refers to calcium. What will happen when this train connects? We get the word hypocalcemia, which means low blood calcium level. This train is ready to leave the station now. Now an engine has the word fragment hyper, which means high or above, and a car behind it has emia, or the blood, and the other car has the fragment natro, which refers to sodium. Now let's put this train together. We now have hypernatremia, or high blood sodium level. The pieces of words we were using have names. The main part in the middle is called the root, and the part that goes at the beginning is a prefix, and the part at the end is a suffix. And by adding prefixes and suffixes, you can alter the meaning of the root word. Now let's practice knowing what is the prefix, suffix, and root of each word as we put it together. Here's the last one we did. Hyper is the prefix, emia is the suffix, and natro is the root. Now for some more practice with the South College Railroad. Peri is the prefix meaning surround, Itis is the suffix meaning inflammation of, and card is the root and refers to the heart. Prefix, suffix, root. What will this word form? Now we have pericarditis, or inflammation of the pericardium, or surrounding heart sac. Chole is the prefix here again. Itis is our suffix. This time, cyst is our root. Prefix, suffix, and root. What will be the resulting word here, you think? Now we have cholecystitis, or inflammation of the gallbladder. What about if the prefix is poly, or many, and the suffix is opathy, which means disease, and the root is now neuro, or nerves? Prefix, suffix, and root. What word will this train for? Polyneuropathy, or disease of many nerves. Here's our last example. Hyper is a prefix that means above. Ism is a suffix meaning condition, and thyroid, of course, is the root that refers to the thyroid gland. Prefix, suffix, root. We'll now put our last train together. We have hyperthyroidism, or overactive thyroid gland. You should now see how combining works. Sometimes we have more than one of something, and that is when we use the plural form of words. But there are rules to follow. Sometimes it's plain easy by adding an S or ES to the end of the words, but there are exceptions. For example, the plural form of burza is not burzas, but burzae. And the plural form of embolus is emboli, or emboli. Some words must have an S or ES depending on what letters they end with. There are more rules to pluralize. Sometimes you remove an X at the end and replace it with a CES if the word is Latin in origin. That makes the plural form of appendix appendices. We add IES to a word ending in Y but preceded by a constant, like vasectomy becomes vasectomies in its plural form. But if it ends in Y and is preceded by a vowel, then just add S. Just add E to Latin terms, making the word like fossa become fossae. We can make words ending in US plural by adding an I, so we have staphylococcus become staphylococci. When there is more than one, if you suffer from more than one psychosis, then change that IS to an ES and get psychoses. Pronouncing medical terms are important as this can save lives and prevent mistakes. Spelling is also crucial as this too may lead to mistakes. Practice makes perfect, so keep practicing as you work week to week. Keep saying the words to yourself to make sure you can pronounce them correctly, and participate in the discussions as we have you use audio to practice your medical terms. Due to popular demand, let's go over some common prefixes. Here are the objectives. They're the same ones you have in Connect. We use prefixes to modify the meaning of root words by adding them to the beginning of the word. We saw this earlier when we were playing with the trains. The hyper prefix made the sodium level high. Now let's go over some common prefixes. Bi and di mean twice or double. Brachy means short. Both hemi and semi mean half. Iso refers to equal or the same, like these boxes. Mega means large. Pluri means several or more. Poly and multi mean many. Sil, sim, sin, cis mean together or joined. Peri means around, about, or near. Quadra and quadri mean four. Tri means three. Mono and uni refer to single or one. Micro means small and microscopic. Pan and pano refer to all or entire. Ad means toward or to. Co, call, com, con, and core all mean together. Ab, abs, and x refer to away from. Hey, where do you think you're going, little hedgehog? Apo means derived, and along with di, diff, der, and dis mean separated. Ana means against, up, or backward. Retro means behind or backward, and re means again or backward. Kata means down. Circum means around. I'm getting a bit dizzy here. Ecto, exo, and extra all mean outside and outward. Infra means position beneath or below, and hypo and sub both mean below or low. Endo means within, and so does intra. Para means near, adjacent, or beside. Inter means between. Per refers to through or intensely. Trans means across and also through and lastly. Mezzo means middle or median. Hyper means above or above normal and overly. Supra also means above and over and excessive. Pro, pre, and ante mean before. Post and meta mean after. Brady means slow. Oh, and this is a turtle crossing. Tacky means fast. Mal means bad or inadequate. Bad kitty. We are now done with your very first medical terminology lecture. Hope you had fun.